You're listening to the Business of Pharmacy podcast with me, your host, Mike Kelzer. Well, hello, Hillary.
Hello. Great to be with you, Mike.
Hey, pleasure to have you on. You're, this is a relatively new podcast for me, but you're an old pro.
So this August marks the, have been doing the Talk to Your Pharmacist podcast for 2 years, which is exciting because almost at the 100 episode mark, I've been really committed to sharing success stories about pharmacy. And it does. It takes a lot of diligence and passion to be committed to that for this long.
Because we all know the slope of a podcast is there's a lot of volume 1, episode 1 podcast, and that's the last we hear from people. So you're a hero in my book. Well, Hillary, for those that don't know you, take us back to, I guess, when pharmacy became part of your life and kind of to catch us up then to where we are now.
Sure. So I grew up in the Mississippi Delta in a small town and attended the University of Mississippi as an early entry pharmacy student. So what that means is, as a high school senior, I was admitted to pharmacy school with the contingency that I maintained my grades and all of those certain requirements. And so as a junior, I entered pharmacy school. Now they have expanded that initial time to 3 years of prereqs from the 2, but I was able to kind of get right in there, which was great. So while I was at Ole Miss, got really plugged in I've always had a passion for advocacy and policy, was on the associated student body as a pharmacy representative, and actually went up to D.C. and interned on the Hill for a Mississippi Senator Wicker, who's still in office today, and got the DC bug, if you will, and wanted to go back for pharmacy. And, we all know pharmacy is a small world. And one of the Ole Miss alums was the director for the Office of Pharmacy Affairs. And I was able to intern there the following 2 summers. And I think people got a little confused. They kept thinking that I actually lived in D.C., but I just wanted to spend all my summers up there.
Yeah.
Which was fun. Got exposed to the 340B program and just exploring a little bit more about public health and how to operationalize a national program. And a passion for caring for the safety net and the underserved, which circles back in with my current work. But throughout pharmacy school, I really sought to have a diversity of rotations to see all of the different avenues of pharmacy. And I remember vividly as a 4th year, you select your rotations for your last year and you're really not quite sure exactly what you're going to be getting into. But I remember being so excited as a 4th year student to see the unique opportunities that we have as pharmacists to be involved in the patient care process, whether it's working in the ambulatory care clinic. I loved being in the hypertension clinic down at the University of Mississippi Medical Center, loved being in the ER, and really just dove into those clinical rotations and pursued a residency, and then made it to Nashville. And
what brought you to Nashville? I'm sorry. Did you start there in Nashville, or did you?
No. So all of this was in Mississippi. Did my residency with the University of Mississippi Medical Center.
And was your childhood Nashville, or what brought you there then? What brought you to Nashville?
No, I grew up in Mississippi in a small town there. Spent all my time there, and I think being exposed to DC, had lots of friends from Dallas and Austin. I knew that I wanted to be in a little bit of a bigger city. And a lot of Ole Miss people were, in Nashville. And actually, I was born in Tennessee, so had some Tennessee ties, but have been here for 7 years and met my husband here. So we will be in Nashville, which is definitely a great booming city and a great spot for healthcare.
Yeah, a good spot for healthcare, huh? With the growth and size of it and so on.
Well, it's actually a real hub for healthcare. You've got the largest private hospitals in the country are home based here. So HCA, CHS, LifePoint. So with all of that, hospital prowess, you've also got a lot of startups that have been generated. I think there's over 400 different healthcare startups in Nashville.
Really? Is that because of its relatively central location in the country, or, versus far east or far west? Or I wonder what brings everybody there.
Well, the Bill Frist, Senator Frist, was governor of Tennessee, then became a Senate leader, majority leader, and he's a physician by training. And so I guess he and his, colleagues had actually founded HCA back in the day. But yeah, then it
kind of snowballed, it seems.
Yeah. And actually Belmont University, which has one of the 3 pharmacy schools in Nashville, their founder of the business school, I can't recall his first name, but Massey, was a high up with HCA. So just lots of opportunity. Vanderbilt's here. I forgot to mention Vanderbilt, which of course has national recognition as a leader. So yeah,
that's neat. Yeah. So back to Nashville you went, and what'd you start up there then? I mean, I believe you were in retail there at the time, right? Community pharmacy?
Yeah. So for all the new grads, you go to school and maybe you do a residency, maybe you don't. And it's that kind of anticipation of where do you go next? Because it is challenging. And what I'll share is, you're probably not going to get your dream job straight out of school. So for me, I really thought that I was going to do hospital pharmacy. I did my residency in that, was interested in that. But when I was moving to Nashville, really the only positions were staff pharmacist positions. And I didn't want to, I made the decision to go into independent pharmacy. I had a actually family friend that owned his own independent pharmacy here just outside of Nashville. And it wasn't an open position, but he needed help just kind of updating his clinical pharmacy services. Setting up an immunization program, going out and connecting with, potential clients like assisted livings. And so I wore a lot of different hats.
Yeah, you kind of built a spot for yourself that wasn't there.
Yeah, exactly. And so I think that was a little bit of a leap of faith, but, that's what he said. He was like, hey, I can get you to Nashville. And he was really generous in that. And I was able to learn a lot and, get exposed to a couple of different things and try and succeed or try and fail at a few things. Right.
Well, so you're in retail a while. When is your next, when and why is your next jump into some of your other endeavors, which we'll get into? But what was the impetus for kind of moving on and doing some of this other stuff after your time in retail?
Yeah, well, if you look at my career path prior to Dispensary of Hope, it looks a little confusing because I did retail or independent pharmacy, and then my boss ended up selling because he owned it for a while. And so I needed to look for a different job and thought that maybe working for a health plan might be interesting. And learned a lot, learned about more in depth about the prior authorization approval and that pharmacists actually are reviewing all of those cases. Working on star ratings, calling physicians, but there really wasn't a lot of interaction with people.
Sure.
And not a lot of creativity in the work for me. It just wasn't a good fit. And what do you know? They ended up being acquired. And so that was another transition point.
Yeah.
And so I tried mail order specialty pharmacy and learned a lot about all the different requirements and got licensed in 11 different states.
Did you have to test in all those states?
Oh yeah.
Jeez.
So there's very strict regs, of course, that vary from state to state, and you've got to have.
Is that the same medical portion, but just different law, or do you have to actually take the medical portion in all those states also?
No, it's just the MPJE or the multi-state jurisprudence exam,
gotcha.
which new grads definitely study up on the law exams because they are not really as fact-based. So the NAPLEX, you pretty much know if you have the right answer or not. But with the MPJE, it's very situational based, and you of course study the law book. You of course are going to study that state's regs, but it is very situational. So there are a couple other resources online that I found, little study guides and things. So
it's got to be hard to keep all those laws straight between. And I imagine if I'm the one doing the test, I'm gonna make it real tricky by making the questions different that I know are different laws between neighboring states. So that's got to be a tricky test to take between all those.
Right. Absolutely. And yeah, so I use a service, or actually pharmacist letter is the best method for me to keep track of all the different license requirements, because some renew biannually, some renew annually.
Yeah, right.
Yeah. So lots to go on with that.
Yeah. So that's the mail order. You had to take those 4. And then where on from that? You had mentioned your the Hope Dispensaries of Hope. What is that?
Right. Yeah. So I actually learned about that while I was working for the independent pharmacy. And because patients that were going to a pharmacy that he also owned inside Centerstone, which is a mental health clinics, some of those patients were talking about Dispensary of Hope when they were having trouble affording their medicine. And I've always been intrigued in, helping people, particularly those that are underserved, as evidenced from our work at HRSA. And just growing up in the Mississippi Delta and seeing a lot of those patients at UMC. And so I was intrigued about this, what is Dispensary of Hope? I was curious too. So I reached out and learned about it and offered to volunteer, and actually helped to develop their generic formulary, and did that on a volunteer basis for about 2 years, just kind of on and off. I've always been really involved in giving back to the community with different community organizations. And they actually got a big infusion of funding in 2014 and were able to hire a pharmacist. And so they came knocking at my door. And so just some background for those of you who don't know about Dispensary of Hope. It's a charitable medication distributor. So just like Cardinal or McKesson or AmerisourceBergen, I'm sure all of you are familiar with those big 3. Of course, there's other smaller ones, Morris Dixon, et cetera. But we're licensed as a wholesale distributor in all 50 states. And Dispensary of Hope is the nation's leading charitable medication distributor. Since 2012, we've been able to assemble a collaborative of most of the largest generic manufacturers and most of the largest health systems who are serving uninsured. And so what we do is we acquire donated medication from the pharmaceutical companies and then distribute that to communities across the country. So to free clinics, FQHCs, charitable pharmacies, and health system outpatient pharmacies so that they are able to dispense that to their low-income uninsured patients.
When I was looking in the nice YouTube video on that site, it was talking about some of the benefits to the manufacturers. Mm-hmm. And one of the things it mentioned that caught my eye, because I had this question, was it said it cut down on their, what would you call it?
Incineration costs.
Incineration costs. Mm-hmm. That got me thinking, what kind of drugs are these that they would have to be incinerated? Are they shorter dated or misprints? Or obviously they're good drugs, but what makes them, either go to you or incinerable, if that's a word, but not to be sold?
Well, actually, so all of the medications that we have are within date. So usually it's anywhere between 9 and 18 months. But what happens in the life cycle of a medication is, you just think about supply and demand. So all of these manufacturers think about just the generic industry. So often you've got multiple manufacturers making lisinopril. And they are going to forecast and try to make as much as they need to sell. And the manufacturer is actually responsible for designating their own expiration date. And typically we see anywhere from 2 to 3 years. But when it hits about that 1 year mark, they really can't sell it to the wholesalers anymore. So
yeah, they're running out of time.
Right. So they're either going to short sell it to one of these secondary ones like ANDA or something else.
Right.
Or they have to, if they've got a lot of surplus, then it's basically quarantined until 6 months of dating. And actually all meds that before they're expired or as they're expired go to the incinerator. So we've got a lot of waste in the industry. You see a lot of that with long-term care and other places. But so we are able to take any of that surplus medicine and put it to good use. So they do get a tax benefit.
Right.
And it increases their corporate social responsibility. That's something that all companies are really looking at these days is how do they give back? And I would imagine
that if they run out, they're going to lose a lot more money in sales than they lose by having a surplus once they take the tax advantage and the corporate goodwill and that kind of stuff.
Right. And actually, I just learned this here recently that the manufacturers have in their agreement with the wholesalers a failure to supply clause.
Oh, is that right?
So when they do not supply, when they fail to supply due to a drug shortage or maybe they don't have enough, they actually have to pay the distributor to purchase it from somewhere else.
Oh, right. Yeah.
So they're covering the cost for the distributor. They're losing money and they're covering the cost for the distributor to get it elsewhere.
Yeah, and I'm sure that price isn't cheap once the other company knows the other one ran out.
Right, exactly. So
what was that about the 6 months you were saying? You said that when it hits only 6 months left, they quarantine it, or?
Yeah, because they can no longer sell it.
They can't do anything with it then.
Kind of sitting there 6 months to expiration, and then they're sending it on.
Yeah, that makes sense.
So,
well, that's cool. So it's a really fascinating organization and very well put together, because a lot of the times I'll go on some websites kind of looking at different show things and that, and this one's really sharp, and it got the point across real easily that you are certainly a national organization.
So we've we serve, I believe, 34 states across the country and over 170 dispensing partners. And it ranges from large systems like Ascension all the way down to charitable pharmacies. So it's really amazing. And it's really the pharmacist is, I think, the hero out of all of this, because
of course
we are, providing this medicine to patients that would otherwise go without. So, a lot of times we're piecing together different programs. So, you've got 340B, you've got manufacturer coupon cards, you've got the $4 list.
Right.
A lot of times hospitals are just, they have a charity care program. And if a patient has, meets certain financial criteria, the hospital will often just provide them their medicine, but it's only that one time at discharge. So we're able to provide it in a consistent fashion so that those patients can come back in. And so when they do have high blood pressure or diabetes or even mental health, they're able to be managed on an outpatient basis. And so we're in turn saving the hospital system often $2,000 per patient life.
Yeah, I'd imagine. So Hillary, is that your full-time job at this point?
Yes. So I am full-time at Dispensary of Hope, have been there. It will be 4 years, November of 2019.
Wow. That's great. Well, then apparently at nighttime, you work on a few other things, being the two of them being your websites of drug information and natural drug information. Do I have that right? And And is this and some consulting and things like that? So when do you fit this stuff in?
Yeah, I have always been I've always had to be good at time management. So growing up, I love athletics still, and really love to do exercise and fitness. And my husband and I do triathlons. If anyone follows along on Instagram at Talk to Your Pharmacist, you'll see some of my triathlon posts. What
distance do you do? I'm gonna guess Olympic. Hopefully not the full one.
Usually we stick to the sprints.
Yeah, sprints. So a mile swim, 3 miles run, and about 12 bike.
12 to 17. Yeah, usually it's about a half mile swim. But for me, I like the longer swim because I'm a swimmer, so that gives me the better advantage.
I got to jump in. See, no one can see what I look like on the screen. So believe it or not, though, I did triathlons back before you guys were born, and then also from 2012 to 15. And I was a swimmer in high school, and it's terrible because in the swim, I'm like in the top 25%, right. But in the run and the bike, I'm well below the bottom quarter. And so I have yet to ever pass somebody in a triathlon. I mean, these people just zoom by me. So that's very, that's not fun. So right. I'm sure you could not be you're good in the swim. That's great. And I'm sure you're decent, at the bike and the run also.
Yeah, my cycling has significantly improved over the past few years. So I just won overall female for I sometimes I'll make age group, but I actually won overall female in one that we participated in last month at Paris Landing. So that was exciting.
Good for you.
Yeah.
That's fantastic.
So
that's fantastic.
Yeah.
I always tell my kids that I always say I won my age group, and I say that's for old guys that were born on October 8th, 1966. And then sometimes I have to say before noon or afternoon. I got to narrow that age group down to like a 3-hour span, like, 50 years ago. So you won your the females.
Yeah. So
dang.
Yeah, it's fun. And so anyway, that's always been a passion of mine is doing athletics. So going back to time management, I learned that at an early age because I would, go to school, then have basketball practice, then cheer practice, then soccer practice. So I was getting home, 7:30 and having dinner and then trying to do homework before going to bed and then getting up. So not a lot of room to, get in trouble or anything.
No.
But, just really,
yeah, that forces you into that.
Right.
I think mine was just trying to get home by 4:00 to watch Gilligan's Island. That's what I had to, do. But no, that's fantastic. That really teaches you a lot to, the old cliche of you want something done, give it to a busy person. So you're certainly a good example of that.
Yeah. So yeah, I mean, I guess back then, I didn't really watch a lot of TV. I don't really watch a lot of TV now. I listen to a lot of podcasts and things, and I'm a big fan of Audible, but that's probably just my maximizer strength coming out. So I can do that while being in the car or something. So
right.
Yeah, the podcast was just a vision that I had, and you don't know if you can do it unless you try it, and that's been happening for 2 years, and then I've had another passion for doing education around the new medical cannabis is becoming really ubiquitous, and It's been approved in 30 plus states, I think 33, 34.
Yeah.
And not advocating for or against, but just we as pharmacists need to learn about it, because
we do. Exactly.
Patients are coming up and asking questions about it. It's starting to come out in all the retail stores and everywhere. And so the goal is to have an online course available to educate pharmacists on that, and that's available on a website, or will be available. And then I'm also going to be launching a podcast dedicated to natural products, and that'll be the Natural Products Resource Center podcast. So,
that's great. What metrics, Hillary, do you put on your podcast to say that it's successful in your eyes? Is it because it's enjoyable for you, it's successful, or do you have any markers? And unfortunately, most of us these days are, never really happy with the marker, because as soon as it gets there, you want to change it to a different goal. But what do you consider your win with the podcasts?
I really don't have any firm metrics on that. I mean, it's still been a fun passion of mine. I love connecting with other pharmacists.
Sure.
And I love learning about what they're doing. And if I geek out on that, I want to be able to share their stories.
Yeah.
And really it kind of comes down to, I remember being in pharmacy school, and they'd have guest speakers come in and share about their different career paths. And I kind of was thinking, wow, like, what if we could scale that and anyone could learn about it? And and so that was really kind of the initial thought, but I think it's just become so much more because I also just have this real I want to teach people about thinking about how to think outside of pharmacy, and just looking at healthcare from a broader perspective, and really seeing demonstrating our value as a profession, driving home that sense of purpose and mission, and trying to build a tribe around that. So for listeners, you're kind of part of the Talk to Your Pharmacist tribe, and you can follow on Instagram and share, and we've also got a Facebook page. So yeah, it's really just been Of course, I can track and see how
Yeah.
it's grown. But
But I'm
yeah,
sure, but that keeps changing. And I think probably that, looking at you and I can see that when you talk about the people you meet and stuff, that sounds like the best metric you could have there.
yeah. And it's really just, I'm just kind of a relationship, I think, Malcolm Gladwell talks about connectors, mavens, and salesmen in his book, Tipping Point. And I would consider myself a connector. I enjoy talking to people. And yeah, so finding guests is the easy part, because I think that my love of learning is always like, oh, what are other people doing? And
right. How are you with your guests? How do you decide who you want? And it seems that the podcast is such a good way to meet people. How have you met them enough or know them enough to then invite them on your show? Or are those more cold and you're not meeting them till later?
Yeah, a lot of it is really organic. So, just existing relationships was where I started. And then that trickles down. So, like people are like, oh, you should invite so-and-so or so-and-so.
Right.
Or I meet them at a conference, or I see something that they post on LinkedIn, or I see something on Instagram, all the different forms of social media.
Yeah, right. Right. And of course, the more you're out there, the more episodes, people know people and so on. So that really snowballs, I'm sure.
Mm-hmm.
Okay. So most people would say, all right, that's enough. I've got the 3 websites going. I won my triathlon category, doing this, doing that. But you got something else that is taking up your time that you shared just before we went on record here. What is that?
Yeah, so I'm working on my MBA, and I have always had an inkling of wanting to do that, but there wasn't ever a good fit. So I feel very strongly of, even though it sounds like I work all the time, I have I think a decent work-life balance.
Sure.
We live in a fun city. We like to go out on the lake when we get invited on the weekends. We love to go out we love to travel, try out new restaurants. But, during the week, we're pretty scheduled. So I've always had this interest in the MBA, but man, I'm not going to take a year off from work.
Right.
I'm not going to commit to being somewhere every weekend. What if I want to be traveling? And through my employer, actually, I've been thinking about as I've been moving more into leadership and learning about leadership, I just really wanted to get more hone those business skills of accounting and finance and marketing, and knew that if I wanted to continue to advance in that and with some of the other entrepreneurial interests, that I wanted to get the MBA. And there are a couple of great programs. The one that I've selected is through Western Governors University. The other thing I meant, so not only the time was a big concern, but financially,
sure.
Some of these schools, it's a 50 or 60 grand commitment. And,
wow.
We don't have that kind of money to just throw out. And I didn't want to take on any large student loans, but through Western Governors University, I found a nonprofit university that 19 governors came together and founded, and great reviews online about it. And it's an online program, so it is self-paced and competency-based. So I can pick it up and do it whenever I want to. So I can of course I'm incentivized because it's based on 6-month terms. So you can take as many classes as you want in 6 months. So
I
the
see.
more
Gotcha.
classes, the less it is.
Right.
But yeah, it's been a great, it's been a really good experience so far, and I've found value in it, and it's been a very reasonable price, and something that my employer is thankfully reimbursing a little bit.
Oh, that's neat. And so, I think at this point in my life, and I have no plans for it, I think if I did an MBA, a good portion of it would be to put those letters behind my name. And it sounds like that's not obviously your top concern by any means. Is that part of it? Do you want to have that behind you for different avenues that will open up? Or what percent would you say is like the benefit, and what percent is knowing people that you now have an MBA for whatever reasons, or any doors that opens just by having that on your name?
Yeah, I think having letters behind our name is a very interesting topic. So yeah, I think that pharmacy has become really interested in that.
That's a lot of letters, yeah.
Yeah, and what's interesting with the medical profession? It's just MD.
Right, yeah.
You see MD, you may see MD, NPH, MD, MBA,
yeah.
MD, maybe PhD. But
right.
Like for instance, the eye surgeon. I'm blanking on what they're.
Like the OD or
no. Anyway, the physician that did my LASIK surgery, I am now blanking on. It's not an optometrist. That's not a physician, but
an ophthalmologist. Yes,
that was on the tip of my tongue. Ophthalmologist. Yeah. I don't know why I wasn't coming to my mind. The ophthalmologist also got his PhD from MIT in physics and was one of the very first to do 3D LASIK. And here in Nashville. And so when I was doing LASIK, I'm like, I'm going to pick him, for that extra training. But yeah, it's interesting. So, I thought about doing the whole BCPS and I haven't needed it in my career. Maybe if you're going to niche down and do, ambulatory care, or maybe something specialty pharmacy, or, maybe you're going to work in the ICU. Some hospitals don't even consider you, if you don't have one of those.
Interesting. Right.
But, for me, I've just been really drawn into more of the business side of healthcare, and, really see myself more moving into a healthcare executive role. And that's something even with, I'm a member of the the American College of Healthcare Executives, ACHE. And, that's something where you can move for any executive, or if you want to move forward and learn more about that type of skill, you could be a nurse, or you might be a physician, or a lot of different areas in healthcare, but can pursue that credential as well. So yeah, I guess I am more interested in some of the non-pharmacy specific and
that's got to help. And that's got to help, though, having that behind your name, right? If you're looking at an executive position, despite you wanting it for prestige or so on, it's got to help. It would seem it would help in the business world moving up in the executive roles. Wouldn't you think?
Hopefully.
It will.
Yeah. So we'll see. But it's been fun, and I think it'll definitely bring value.
Yeah, good for you. All right, I got a couple questions for you. What what professionally or, professionally, financially, not personally, but what things cause you to get butterflies in your stomach or lose sleep or worry about what in your career, whether it's job security or a million other things?
That's an interesting question.
Or are you just like, everything is great, give me some lemonade, just gonna hang out?
Personally, I don't struggle with that. What I am concerned about is the health of our profession, and I think that we're seeing a lot of change. I mean, there's change happening everywhere in the healthcare industry,
right?
So it's not isolated just to pharmacy. But what I really, that's probably what keeps me up at night is, you see there are layoffs.
Just today we heard.
Yeah, Walgreens is shutting down some stores,
Walmart,
and Walmart had laid off some people, and you see that, or hospital systems, or maybe they're laying off people,
right?
So I think that's probably what is the biggest concern for me.
Sure.
And I think that, it is a very complex issue, and people are definitely very emotional about it.
Yeah, I bet.
But, we really have a choice. How do we respond to that? And, you can choose to respond with kind of this can-do attitude and, really looking at ways like, all right, well, what's the worst that could happen? Okay, you lose your job, and then what?
Yeah.
Well, then you look for a different job. Maybe you don't find, and then what? And so kind of thinking through like what's the worst case that could happen, kind of thing, and then you just start, there with a pharmacy degree, there's so much versatility.
Yeah.
Maybe it's not what you have been doing, but I mean, just look at
Exactly.
my career. Things came up, and I was like, gosh, well, I got to make a shift, and you do, and I think that the training that we have from pharmacy school, we are really good at. Or we have a lot of value that we can bring. And so I think it's just being perseverant, keeping a positive attitude, and actually staying engaged. So, if we don't know what's happening, like if we don't know, the payment models are changing. And so while we did make a really great living with being reimbursed based on, filling drugs,
right?
That's changing, and we're moving towards value-based care, and so we need to be there advocating and demonstrating that value. And so, I was talking with some people from CMS here recently, and everyone talks about the physicians and the nurses. And I'm like, and the pharmacists,
right.
we've got a primary care shortage.
Yeah.
And this bill for
exactly
having pharmacists serve primary care population, especially in rural areas. You've got 90% of people live within 5 miles of a pharmacy. So we're very accessible.
If you had to stay in the workforce, you had to you still had to have money coming in, but you could do it any way you wanted to. What job where would you like to be spending most of your time? Some pharmacists will say, well, I want to write all day, or I want to do this all day. What would you be doing if you could take any job you wanted to and you didn't have to worry about the pay rates of any of the jobs?
Yeah, that's an interesting question. And, I'm really blessed because the work that I do at Dispensary of Hope is meaningful and challenging, and there's a lot of variety. So for me, it fits really well. Some people want to have a schedule every day. For me, I feel like I'm using a lot of those skills.
That's great. It sounds like you're right in the spot you want to be.
Yeah, you got to find your sweet spot. And, in the future, I'd love to maybe own my own business and, really expand with the work that I'm looking at doing with the Natural Products Resource Center or maybe there's another venture that I want to launch or co-launch with somebody. I think that speaking out for the profession and advocating and that's something that I hope to continue to do as well. So I think that will probably be something that I just am really interested in.
What if you did not have you weren't allowed to work, and even though you wanted to, they said, Hillary, you just can't do this. What are you then spending your time on? I think it sounds to me like you always have to be moving and problem solving and that. So,
that's an easy answer.
What would you be doing?
I would be traveling around the world with my husband.
Awesome.
Yep. I sometimes fantasize about if I could have a travel blog and just travel. But
so you got that all planned out in your head.
Yeah, that would be really fun if I didn't need any money. Now, we don't have children yet. So of course that will probably change things. And
sure.
Who knows, if you're living on the road for, months on end, there is something to be said about being in community with people.
Yeah, right.
Being grounded. But, it's just, we just have such a great time. And I love experiencing all of the different cultures and seeing different places. It's just
that's
really
neat
enjoyable.
That you know that. That's really cool. That's really cool. Yeah, I've yet to get, I think I've been to Canada and Mexico. Now the younger generation is like, if you haven't been overseas, like by the time you're a senior in high school, it's like something's wrong. We were never like that. Did you travel in high school?
It's funny that you say that because I think we did a cruise. We did a cruise.
Yeah.
Bahamas in like 6th grade, but my first real trip was before my senior year of high school.
Of course. See?
So it was a big 2-week trip. About 40 kids from my high school went. And we had, actually my mom was she taught school at my high school and was a chaperone. And so about 40 of us kids, we did England, France, and Italy. And I just loved it. And then really didn't have the chance to go back. So I had some college friends that went and did a study abroad. And that is the one thing that I regret from college is that I didn't get to do study abroad. But
not doing that.
But, my parents weren't, they were like, well, you can either do DC next year or you can do study abroad this year. And I picked DC, and I think really life and career wise, that ended up being a great decision.
Yeah.
But, we couldn't afford to send me to do, 6 weeks to Italy.
Yeah, exactly.
Exactly. So hopefully I can be able to give our children that experience because I think it would be interesting to have that in college.
My wife and I always joke because as our older kids start doing some of that traveling, we always have kind of we make believe that we've been to Paris, so at least we can fake name drop with the kids as they're talking about their travels all over the place. Mm-hmm. Yeah, I'm jealous of that, but I guess we'll have our time. So, well, Hillary, it's been a pleasure talking to you.
Yeah, well, thank you so much for having me on as a guest, and best of luck as you grow wings with the Business of Pharmacy podcast and enjoy talking with you.
This was the Business of Pharmacy podcast with me, your host, Mike Kelzer. Please subscribe for future episodes.